Also, some worrying news emerging today about COVID-19. There's a sharp increase in hospital admissions of under fives. The NICD says this is a new trend and wasn't seen in the third wave. Heidi Giokos is following this story for us. She joins us now live. So, Heidi, a very worrying picture, especially regarding under fives being hospitalised in this wave.
Definitely a very worrying picture, Shahan. We do understand that the data and the analysis that's coming out from, and the surveillance rather, that's coming out from these hospitals shows a different trend compared to the third wave. So what we saw in the third wave was those 60 and above and 50 and above being hospitalized, especially because they were not vaccinated. But now it's a different trend. We've been told today in that briefing by the Department of Health and doctors that it's very different. The second largest group that's being hospitalized because of this fourth wave is under 5-year-olds. Many are asking the question, why would this happen to under 5-year-olds where previously this didn't happen? Well, it seems as though it's because they're highly exposed and they're susceptible to being infected with Omicron because they are not vaccinated. We're also picking up the fact that those between the ages of 12 and about 15, 17-year-olds are also being hospitalized. Why is that happening? Also because they've just been vaccinated, and we do understand that they've only received one Pfizer dose. Even though government has said that that can provide sufficient protection, it seems as though Omicron is moving into unvaccinated. It's also a very different picture in terms of hospital admission, Shahan. We know in the last week only, there's been an increase, or in the last 14 days, there's been an increase of over 300% when it comes to hospital admissions. It's the younger population that's being hospitalized, and from what doctors are picking up, it's the unvaccinated. Let's listen to a little bit more of that.
Third wave, we saw more admissions in young children under 5 and in teenagers 15 to 19. And now at the start of this fourth wave, we're seeing quite a sharp increase across all age groups, but particularly in the under 5s. But to show what it means in context, on the right is the admission incidence risk by age group, and this includes all age groups. So apologies, it looks very busy, but I'll take you through it. Right at the bottom, you can see the young people 5 to 19. In yellow is 15 to 19, in grey 10 to 14, and in red 5 to 9. So as expected, the incidence is still lowest in those in children. However, the incidence in those under 5 is now second highest, and second only to the incidence in those over 60. And so the trend that we're seeing now that's different to what we saw before is a particular increase in hospital admissions in children under 5 years.
Very worrying numbers in Gauteng, of course, being the epicenter yet again. How are they going to tackle the province?
Yes, Shahan, I think it's important to highlight the fact that yesterday the Gauteng Coronavirus Command Council briefed about its readiness and preparedness with regards to the peak of the fourth wave. We do understand that the country as a whole has entered the fourth wave, but of course, Gauteng being the epicenter, as the majority of the cases do come from this province. I mean, yesterday we saw over 11,500 cases reported nationally, and the majority of those come from this province. But Gauteng Premier David Makuda is saying that in terms of locking down Gauteng, just the province, we saw this previously in the third wave, because of how busy this province is, because of a constant movement and how worrying these numbers look like. The Premier is saying that's not really a discussion right now. Rather, they're trying to push and motivate for people to get vaccinated. How many people have been vaccinated in Gauteng? We know it's over 7 million doses that have been administered, fully vaccinated. It's not even 4 million yet. And we do understand that 8 million people still need to be vaccinated in Gauteng. It's a huge task for the provincial government here in this province because there's a lot of vaccine hesitancy. And as you can see, the numbers are on the rise, and the best tool, according to the Department of Health, scientists, experts and doctors, the best tool right now is to just try and get vaccinated. But let's listen further to what the Premier had to say.
The biggest weapon for us to fight the fourth wave is really vaccination. We didn't have vaccines during the first wave. We didn't have vaccines during the second wave. At the height of the third wave, we only had our health workers who were vaccinated and the elderly. But now we have more people, even young people are vaccinated now. That's the most powerful weapon in our hands. Obviously, we would like to avoid the things like shutting down the economy. The lockdowns were very good for the phases in which we were. In the early phases where we didn't have vaccines, the lockdowns did their work, but we don't think we should be doing lockdowns now. There's been a lot of hurt to people's livelihoods, to businesses, to incomes, to jobs. We have lost lots of jobs. So we just need to take the most positive step, and that most positive step is vaccinate. Don't shut down the economy, but vaccinate. And the more we vaccinate, the better, because we will not really resort to those extreme measures. I regard lockdowns as extreme measures because they hurt in the course of protecting people. The lockdowns really hurt people in many areas, particularly in the economy. So we can avoid lockdowns by vaccinating and getting vaccinated and vaccinating more people.
All right, Heidi Giokos following that story for us.